Thank you, everyone, for joining us for another Learning Lunch hosted by FormatApproved.com. My name is Brian Johnson. I'm the Senior Director of Online Education with Format Approved, and I'll be your moderator today. Today's Learning Lunch title is Meaningful Use 2, The Rude Awakening in 2014, the Year of Change. We're joined today by Justin Neece of EngagePatient. EngagePatient. Justin is an expert in patient engagement, meaningful use, and health information exchange. We're excited to share his expertise with you today. It's going to be an exciting subject, and 2014 is certainly a big year of change, so we thank Justin for joining us. Before we begin, just some quick housekeeping notes. Remember that you can ask questions of our presenter at any time during the session by entering them into the chat area. In the second half of our session, we'll address as many questions as time allows. If we run out of time, answers to all those questions will be posted to our website and sent by email link later in the week. Also, remember that all registered attendees of today's session, whether they were able to join us today or not, will receive an email with links to both the slides and the recorded version of the event. So people often ask us during the session if they can get a copy of the slides, and rest assured that you will get a copy of those. Well, Justin, before we begin, thank you again for joining us. It's really a pleasure to be able to share your expertise with people.
Thanks, Brian. I'm glad to be back again. Look forward to the session.
All right, well, let's go ahead and get started then. 2014, the year of change, you've called it. What's happening with meaningful use? Has there been some big CMS or ONC announcement that's changed things?
Yes, and I'm sure a lot of our participants today have heard of the change. On December 6th, the Centers for Medicare and Medicaid Services proposed a new timeline for the implementation of meaningful use for both the Medicare and Medicaid EHR incentive programs. The summary of is that the revised timeline extends meaningful use stage 2 through 2016, and stage 3 will begin in 2017 for those providers that have completed it at least 2 years in stage 2. So that was a big announcement, I think, to the market. I would say that on the provider side, the physician side, the hospital side, that the majority of folks, I would say all, very happy to hear about the news. This ties directly to the supporting health information technology in the market that has not gotten to the full capabilities that we will talk about today.
I think a lot of people were hoping that maybe CMS would delay stage 2, and there was even some confusion along those lines, but the delay is really in stage 3, correct?
Yes. To really take advantage of the incentive program, and I know we're going to get into these details today, providers who want to take advantage of the incentive program, my advice today is going to still be to push forward and really put the pressure on your technology supplier to help you get there.
So what's the meaningful use attestation period for 2014? It's a little different, isn't it?
Yeah, well, it is in, in general, meaningful use, obviously, for the market is a bit complicated and can be very confusing. And now, obviously, with some updates from stage 1 to stage 2, and we'll probably see some adjustments from stage 2 to stage 3 as well. But to answer your question specifically, if you are trying to take advantage of the incentive Medicaid, you can begin the attestation for any continuous 90-day period. Now that is different for Medicare. For Medicare eligible providers or eligible professionals, you have to start on the fiscal quarter. Don't ask me why, but that is the actual ruling. So in other words, to give you an example, if you missed applying and getting in line for your attestation on January 1st to go for the first quarter, you will have to wait until April 1st to start second quarter. Again, that's just for Medicare. And the other thing, Brian, that I would like to highlight is remember that the attestation period is only 90 days for just 2014. Prior to coming into 2014 and post 2014, meaning being the 2015 and 2016, it's actually an annual period for attestation. So that's something I want all our listeners to understand very carefully. Now that could change as we go forward, but as of right now, 2014 is the 90-day attestation period.
So this is another thing that I think has really confused some folks. What does it mean now if an EHR is a 2014 edition? And what does it mean for providers if they're already using what we used to just call a certified EHR? What does this mean?
Yes, very important. As EngagePatient is today, we are certified on the 2014 edition, and for all of those technology platforms, electronic health record systems, and even hospital information systems that are providing an ambulatory solution, to get stage 2 incentives, if I'm a provider using a certified tool, I have to make sure that I'm using a certified tool that's been certified on the 2014 edition. And what that means, Brian, in layman terms, is that everything up until with stage 1 and up until stage 2 was on a prior edition, 2011 edition. Now, when all of us went to get certified on stage 1, that was on just the stage 1 criteria. Since then, with stage 2 that came out a couple of years ago, that is on the newest edition of criteria. So the certifying bodies like Drummond, ICSA, who we all as technology vendors have to go and get our product certified, we have to do that on the 2014 NIST requirements or 2014 criteria. So that's what that means. Now, again, why is that important? If any of our listeners who are going to get stage 2 incentive dollars, they can only do that if they're proving and showing that they're using an EHR that has been certified on the latest edition, and as of right now, that's the 2014 edition.
So what's the last year then for Medicare eligible professionals? What's the last year that they can start on Meaningful Use 2 and receive bonus payments?
Yeah, this is a very good question, because even with the extension, if you want to take advantage of the incentive program, you have to start on an MU1 tool at least this year for new folks. So let's say you've never purchased yet, and there are still some folks in the market that haven't adopted or an EHR yet. This is the last year for them to get into the incentive program. And the great part about that, as we've said on here, this is an approximation. There's some there's some great tools out there, Brian, that we can provide for our listeners. Some tables on CMS's website, ONC's website, and maybe some other websites that we're happy to provide. But if you can get started this year, you can still approximately, for Medicare, not Medicaid, Medicaid has different calculations, but for Medicare, you still earn up through 2016 approximately $24,000. But you have to go through, I'm sorry, go ahead.
I was just going to say that's per physician, correct? So that's a significant sum.
That is correct. That is correct. It's the program is only by provider, so it's only by at the physician level. A practice can't go through attestation. It has to be specific with the provider. So that's a good question. But yes, it is per provider. So $24,000 approximately over that 2-year span. Now here, I want to go back though and make sure you understand. Again, but you have to attest in 2014. This is the last year you can get on the system. And remember, if you're doing it for Medicare, you have to start by October 1st because you have to attest for 90 days. So essentially you've got, today is February 18th, between now and October 1st, you need to decide what your plan is, get on that EHR platform and make sure it's certified, as we talked about, and then get in line for attestation by October 1st. That's why I have the deadline there at October 1.
Well, this is a great opportunity for people who maybe have fallen a little bit behind on doing their meaningful use, because this year they have, the attestation requirements a little looser, and they still have time to get on board and get going with this, and there's still quite a bit of money available. So this is the time. If you haven't done it yet, this is the time to get going.
That is correct. I mean, you're absolutely right. I mean, if we were on an annual attestation, we had to have started by January 1st of this year. So there's still time, I guess, is the message, to take advantage. But again, as we'll talk about, you have a lot of opportunity to make sure you select the right solution set in the market that matches your needs. So we'll talk some more about that.
So, we're almost through the incentive phase, you were just saying, and penalties are coming. What penalties do providers face if they wait until after 2015 to adopt an EHR?
Well, penalties for Medicare are still going to flow. So if you haven't adopted, you will begin to receive an assessment of, it's going to start at 1% of your Medicare payments. So again, it's important that if you have not decided to adopt an EHR, a certified EHR, I should say, you really need to do that this year to avoid those penalties. And I would say this too, Brian, that again, there's some good material that we're happy to provide. The penalties, that they actually look at the performance of the past 2 years. In other words, to avoid the penalty in 2015, an eligible professional that successfully attests in 2012 would need to meet meaningful use for the 2013 payment year, because it looks back 2 years. So to avoid a penalty in 2016, the eligible professionals need to achieve a meaningful use in this year, 2014. Again, it starts at 1%, but it's going to escalate as up to 5%. So this is the year, the final year to jump on.
Yeah, that makes a lot of sense, and again, it just speaks to the urgency of getting going. That the penalties is just going to get worse if you don't start this year, you're going to have a penalty, and it's just going to get worse from there. So now's the time.
It is. It's a domino effect, and it will continue to build. Yes.
So this is this is a question some folks may have. Why are we doing this? And what was the
Yeah.
original point? What are we trying to achieve here?
Yeah, there's two things that I would like to, say, and some folks, obviously they're welcome to disagree, but the whole reason originally, and I think we all probably need to hear this every now and then, is okay, well, I get the specific regulations I got to follow, but I've forgotten, why are we doing this? Obviously, we're trying to dramatically improve the health outcomes for everyone. There's obviously a lot more focus as we move towards stage 3 on chronic disease. The CDC has released information very specific to chronic disease, and now 1 in 2 Americans has a chronic disease, which is an unbelievable stat, and that is going to continue to grow through the next 5 years at dramatic rates. And the other stat is that 1 in 4 have multiple chronic disease, or at least 2. So there are reasons around this that obviously we're trying to help control health outcomes for patients. But the summary of why we're doing stage 1, stage 2, and stage 3, as we say here, the first step was we all know, and I'll remember walking into the offices and seeing a separate room of all the folders of all the patients and all the paper that are in those folders. Part of this was to digitize the health information, but then it was to power that information into better care, right? And then stage 2 was about, now that we've got it digitized, how can we seamlessly move this information around, not just with our primary care, but even our specialists, and how they can be on the same page when we get to them and know what my encounter was like with my primary care. And then obviously stage 3 now is about, or will be about, what I talked about at the very first, which is population health management. How can we take this information and actually improve the lives of those who are on very specialized care plans around a specific care, chronic disease like diabetes, for example. So this is sort of the why that we originally, decided to go down this road. Again, lots of people could disagree with this, but this was the reason.
No, and I think it's great to review this and touch on the fact that this is the overall goal. And I'm glad you mentioned diabetes, because if you look at things like the clinical quality measures that are part of meaningful use, you can see a focus on a lot of those chronic conditions. So I do think it's really
yes,
exciting that we're moving in this direction, even though it's not completely painless getting there.
Yeah, right.
So what are the greatest challenges then for stage 2 here in 2014?
Yes, here's what we find EngagePatient, our company, in the market. Obviously, we're very focused on some people call it the last mile. It really, we could all argue that it should have been the first mile, which is connecting and communicating with the patient, not just in the 4 walls of the practice or the hospital, but truly once the patient leaves that facility and out to where they live, work, and play. So that's what we're focused on patient engagement, and obviously where we are seeing now the greatest challenges in the market is primarily around this added criteria to meaningful use stage 2, which is very focused around involving the patient in their own care. And to do that, it's truly connecting them to the physician or the providers that let's call it their care team. So with meaningful use stage 2, there are some new, very specific criteria that the providers, the physicians, will have to attest for and prove that they're hitting these metrics. I know we're showing those four. Very simply, I'll just highlight each one of them. The first one, which is one that is probably the easiest to meet, Brian, is showing that we can push a clinical summary, a summary of my visit with my doctor, and that has a very standard format now. We've all agreed to the format, and that piece of paper must be digitally pushed to an online tool. Lots of folks call it a portal, but it's through the web, and the patient has to be provided access to that very timely. And so the attestation says you've got to prove that 50% of your patients and their clinical summaries are getting pushed to that portal. So that's number one. Lots of folks are not having issues in meeting that. The other piece of that is that now I've got to prove that those are actually getting digitized into this format, that clinical summary that I talked about, and there's some specific criteria around that. That has to be provided to them within 3 days. Again, those two are not as difficult. There are some things in the with your vendor that you should ask about on those two, but where we see the largest gap and the largest challenge now is with that 50%, I now have to show that 5% of those of my patients are actually doing something with those clinical summaries. And that means they have to click and view it, they have to click or download it, or they have to click and or ship it to another provider on their care team, which is in MU2 language, that's called view, download, or transmit. And so you have to prove that 5% are doing that. That is a very tough metric that we're finding a gap in the market on. And then the last one is around secure two-way messaging. A lot of us think of that as allowing, oh my goodness, now we're going to allow the patient to send me a message, to send me an email of some sort. Yes. You have to prove that there is a two-way communication, that you sent something and they answered back in some format, or they sent you a question and you answered back with 5% as well. So those last two are the ones that we're finding in the market that are very tough for folks to hit. Again, all these revolve around patient engagement criteria.
Well, I'm sure we're going to cover some of these in a question session, and we already do have a number of questions from folks. I'd remind people that they can go ahead and ask questions now. We're going to hold those to the end, or you can ask them then, but we'll get to as many questions as we can. I think there is a lot of concern, as you were saying, around some of these engagement thresholds and how people are going to meet them, so I'm sure we're going to have a lot of questions about those. So what are your recommendations for those without a Stage 1 certified EHR? Or I'm sorry, for those with the Stage 1, excuse me, with a Stage 1 certified EHR. So they've got the Stage 1, they've sort of worked with that EHR. Now what do they need to do if they're ready to move on to Stage 2?
Yeah, and actually I'd like to answer your question as well for those that maybe haven't adopted yet too.
Okay, great.
But we'll start with those. Yeah, let's just start though with because there's a lot of numbers out there, but somewhere between I'm going to say 65 and 75% of the market has adopted an EHR certified, at least meaningful use Stage 1 certified tool. So there's a larger percentage now of the market that has adopted, and so the question is, okay, what do we do if we are preparing to go through attestation for ME2? I think the first step is you need to be in conversation with the EHR vendor and their solution version release that you're on and you're using today. And the biggest question is to start a dialogue with them that says, hey, we are ready to go for stage 2. We want to get in line, and if we're Medicare, since it's, as we use an example, we're in February, we want to look at going through attestation in April, or we want to look to the next one, to the next fiscal quarter. With all that said, then what is important that you find out is what we talked about earlier, is are you, if I was talking to my EHR vendor, are you certified on the 2014 edition yet? That's the big question. The answer is no, then obviously it's okay, when will you be ready? Those are really the first 2 questions, and I think that I would ask them to walk you through the main attestation requirements. You'll have to prove similar things that you did for ME1 in that criteria, but specifically on the patient engagement criteria, which are all new, what we've seen is folks are not quite ready for that. And so that's going to be important for you to walk through that. Now, real quick, Brian, back to your, the other
version of that question, okay. I guess. Yeah.
Yeah. Well, let's say I haven't purchased an EHR stage 1 yet, but I know 2014 is the last year to take advantage of the incentive, and I want to jump on. Can I do that? And what would you recommend? Obviously, technology has come a long way over the past 3 to 4 years, and what I would advise folks is shop around. There's hundreds of EHRs in the market. Obviously, you want to make sure you're latching on to someone that is truly going and has the intent. If they have stage 2 certification in the 2014 edition, I think that's a good sign. But you obviously want to pick someone that is going to be certified on the 2014 edition and obviously has a product roadmap to go through stage 3. The other thing to think about, though, is now that especially specialists, really you have a lot more options to shop around to really find a tool that matches your specialty, your provider, workflow, and how you want to take care of patients. So, and for those that are already on an EHR, one of the reasons why we call this the change year is because we are hearing in the market that a lot of folks that were early adopters are thinking about making dramatic changes and going potentially with other vendors. So there's a lot of activity that will happen in the market this year around either changing from the current EHR they have and or buying a new EHR for their practice. So those are the things that I would point out, Brian.
I'm glad you mentioned that because we've heard the same thing, and a lot of folks got their EHR kind of in the early days, and now that they've got some experience with it, they realize that they may not necessarily like the way it works from a workflow perspective or whatever. And this is a real opportunity again this year because there's a limited period that you have to report on. it makes, if you are interested in switching to a new and improved EHR, it's a real opportunity that you only have to attest on that limited period, so it makes the transition a little less daunting, I guess.
Yeah, and again, as we call out on the slide, I mean, there are the way that there's been some changes on how you go through attestation and the modules that are core modules that you have to attest to, and then you have flexibility in selecting other modules. And again, we're happy to follow up and send this information out. We didn't go into this level of detail today, or we would probably have to have a 2-hour webinar. But again, there is some more flexibility now, even in the attestation process. But the key thing is, we put a note on here, you really need to understand what is not excluded from your attestation, and the patient engagement ones we showed you earlier are not excluded, as an example. There are several others that aren't too, but again, this is what we would recommend that you focus on, because some folks, Brian, went through attestation many months ago, and so as we all do, we get through this big hurdle, and at least for me, I forget about things when we get 14, 16, 18 months later. So really push on your vendor to help you walk through this. They are supplying you this capability, and part of that service is to help you be prepared for MU2 as well.
Yeah, those are great questions to ask. Just so you know, we did have at least one volunteer in the audience who's ready for that 2-hour webinar. So I'd say that's a vote of confidence.
Okay.
Well, you've talked about some of the things people need to focus on in 2014 in terms of patient engagement. What are areas that are really key to focus on?
Yeah. Again, I think we covered some of these, but I think that all of the viewers who are either a provider, and which are I'm assuming most of our viewers today, and or they we probably have some vendors that have joined, or technologists that are out there as well. I mean, the key thing is it's all about the certification step, and we can talk about quote waiting and pushing out our decision, but my advice is to stay on the plan, and the first step is to for both sides of the fence, right? The physicians, the providers who are going to go through attestation, and the technologists who are supplying the capabilities to those providers. It really comes down to, when am I going to get certified? And once you make that decision based on the information we've given everyone today, now obviously let's back into a plan. Okay, my technology platform said they're going to get their 2014 edition certification from Drummond and ONC in late May. Well, if I'm, again, going after the Medicare incentive, I've missed the April 1, so now I'm going to do July 1, right? So can we hit that target? It's a bit of some project management, and I know that, providers don't have a lot of time to do this, but remember, as we talked about, why we're doing this, and actually the second reason is, remember, there's a healthy incentive payment that you could get. So that's something to remember. The the folks that, as we talked about, who haven't purchased yet, it's important to really think about and look at objectively what type of system in the market would best fit us. So put that plan together as soon as you can. There's a lot of folks, and I know folks that have done webinars through Formed Approved, who are great service providers that are helping physicians and helping practices in the market make these key decisions. So there's a lot more help out there than there was in 2008. So those are things to think about in 2014. And again, remember, that October 1st is approaching quickly. So put a plan together, and my advice is do the 90-day attestation, because this is the year to get that done.
Well, and I love your advice here in general that, find the right system for your organization, because there's a lot more resources to help people, as you were saying, than there were in 2008, but there's also a lot more in terms of specialty modules for the EHR and the things you were mentioning before. So you got a lot more options. It might be worth looking into what you could do that fits your practice.
Yes, there are some great EHR systems that are in the market that decided to build their capabilities around, one specialty, and so that, and obviously there are some very large companies who provide these services in the market who are trying to be, the one-stop shop, and I'm not saying that those folks can't provide the core capabilities, but back to what you said, Brian, you have a lot more options today. You have a lot more options, so take advantage of that.
Now, this is a question that may be on people's minds. There's been some news on this recently, although that was a really egregious fraud. But let's talk a little bit about attestation certification, and is there a risk of fraud? Do people need to be concerned about this issue?
I think that obviously there's always a risk. However, I am one of the belief that in all the folks that we talk to who provide an EHR, the majority of them, a very high majority of them, are doing all the right things that need to get done. So what I would first say is that when we buy an automobile or when we buy something in the consumer world, especially of a significant outlay of capital, right, or cash, we all go through a very structured due diligence, and I would advise, we take that same path. Obviously, HIPAA compliance is very, very important. We all need to ensure the privacy of PHI data. So obviously that is of utmost importance. But second to that is obviously we want to validate that we're selecting a vendor who has said and has proven to us, because we all get these certificates from ONC that says I'm a certified tool, right? So I think we all, and all of our listeners and viewers would say, we are doing that. Obviously, don't second chance that. Go through the due diligence to do that, and make sure that vendors are providing you the information that says that we really do what we say we do. Part of that, is going through an extensive product demonstration. Part of that is checking references. So there's a lot of things, and all these things obviously folks do, but I would just remind you, to walk through those pieces. Now, one thing I will say on the attestation piece is that for those of you that have gone through that, with stage 2, the patient engagement features and functions that we talked about, where we see EHR struggling with that is on the reporting side of that as well. there's the criteria very specific to get to this 50% and 50% and 5% and 5% that we talked about earlier, Brian. Those come to what is called in Meaningful Use Stage 2 as numerator calculations. And essentially, if you think about it, we can show that we have 1,000 patients and that we pushed 1,000 clinical summaries out there, right? That's the denominator. But what I'm getting at is now I got to show how many opened it, right? And that's the numerator. And so that functionality tied to the back-end reporting is something that we're seeing in the market is becoming a challenge for EHRs. So one thing I would point out is when you talk to them about these patient engagement capabilities, make sure you understand and actually see how they're going to show you they can pull that reporting together, because when the auditor is there to take you through the attestation process, this is going to be the first question around these patient engagement criteria. So that's another example of making sure that your EHR can really do what they say they can do.
And we've heard that some folks do wind up getting audited because either through confusion or whatever, they submit numerator data that's basically impossible, and then they get flagged right away because, you know, that's an obvious sign that there needs to be further examination of that attestation. So it's definitely a good recommendation to keep track of that stuff. Well, we're to the question and answer phase, and I'm glad we are because we got great questions today. I've been keeping an eye on them as you've been talking, Justin. So I'd like to dive into those, and then I'd like to save a little bit of time at the end to learn a little bit more for folks about EngagePatient. So let's get to the questions now, and we'll save a little time at the end to talk about your company. So let's see.
Okay, great.
First question is, I have a behavior health clinical just implemented an EMR. Can we begin meaningful use in 2014 for Medicare? So I guess the question is around mental health, or I'm not completely sure how to interpret that.
Yeah, I think what they are asking is that, I mean, the first assumption I would make is that they are using a meaningful use certified EHR, and because that's what they purchase. And then I believe the question is, can we get in line for attestation to go through the Medicare incentive program to sign up for that? And the answer would be yes. Again, and the question was Medicare, right?
Yes, it was.
Yeah. So the thing is to remember is, again, and I don't know why the government does certain things, but for Medicare, you have to start on the fiscal quarter. So if you wanted to get in line now, again, you'd want to apply for April 1st. And the only other thing that I would add to this, and again, Brian, I'm happy to, we've got some information we can send out from CMS, is I would ask them to work with their EHR and review, and again, you can access this through CMS or ONC's website, is for behavioral health and any other specialties to take a closer look at what specific requirements that they will need to go through. If you'll remember, I talked about there are a certain set of core measures, there are menu measures, and then there's going to be clinical quality measures. And they learned in stage 1 they were being very rigid about very specifically what you had to go through, and now there is a different way to allow for all these specialties to be able to go through and not have to stick to, let's say, what they originally started with, which was trying to fit everybody into the same peg. And so I would ask you to review those requirements which are around 15 core measures, 5 menu measures, and 6 clinical quality measures. And again, we can send this information out, Brian, later.
Well, here's a question about that we sort of touched on, but I think it's a good point to clarify. If an eligible professional is on their first year and they're just starting this year, does the EHR have to be 2014 certified even though they're on stage 1? Or if they're using an EHR that's 2011 certified, is that okay?
Yeah, for stage 1, it's okay for 2011.
But it might make some sense to go ahead and get one that's 2014 certified, I would think, if, you know, because down the road they're going to need to do stage 2. So that would be something I guess they'd want to think about.
Well, yeah. I mean, I would go ahead and ask them for that, for the participant that asked that question who is ready to go through the stage 1, is I would make sure they know exactly what the product roadmap is for their vendor, meaning what you just said, Brian. Okay, we're going to go through stage 1, but I'm assuming the participant would also like to go through stage 2, you know, as soon as they're ready. But again, you can't do that unless they're on the 2014 edition. So I would go ahead and ask that vendor, to your point, are you 2014 edition? If you're not, when do you plan to get that? And listen, we watch it every week. We look at this every week, our company does. And when you look at all the vendors that got certified in stage 1, there are only about 15 to 20% now that have gotten 2014 edition certified on stage 2 out of all the vendors that are out there. This is why it's very important for you to ask your vendor that you're on today about that 2014 edition. And furthermore, Brian, this is why this got pushed out a little bit, because obviously the vendors weren't ready.
So here's a question about penalties. For Medicare providers who do not initiate meaningful use by 2014, and now they're going to incur that 1% penalty, how do they avoid the penalties just going up and up to 5%? Should they participate even though they're not getting incentive payments?
Yes, absolutely. That's the only way that it will stop it from continuing to climb. And it's 1% per year. And again, there's a good table within the CMS information that shows all the way out to 2018, and it shows the escalation. But even though you've decided, to your question, Brian, that you're not going to take advantage of, let's say, the incentive program, again, it's a retro look back 2 years. So if I don't start in 14, what's going to happen is you'll get the 1% penalty in 16. If I don't start in 15, I'm going to get 2% in 17. Right?
So the sooner you start, the better off you are.
Correct.
Well, here's a question.
Now,
oh, go ahead.
I would say this, Brian. Now, again, there are folks out there that who are going to say, now, I believe it's a very small percentage that, 1%, doesn't mean a whole lot to me, and that's their prerogative, right? But if you, back to the listener's question, you want it to stop, you've got to adopt a certified tool.
Yeah, I mean, I think that's important to remember, is some folks may not see many Medicare patients. Maybe they don't think it's worth it, although I think there's still lots of good reasons to adopt an EHR, but that is something that people may apply to some folks. Now we're getting into some of the patient engagement questions, which I thought were exciting, because some people are voicing kind of some of the concerns and frustrations that we hear sometimes. So here's one I want to read to you. Why are there no allowances for patient preferences, including deviating from the standard protocols over which providers really have no control? So I assume that what they're talking about here is, what if patients really just are disinterested in these patient engagement tools, why can't we then take account of that and not have to meet them?
Well,
maybe we should just forward that to CMS.
Totally. Yeah, I mean, I wish I could give someone a good concrete, but, you know, I think, and of course, you know, I'm probably the wrong person, because I'm going to be a little biased, because we obviously sell a solution set around patient engagement. And what I, you know, there's two things very quickly that I would say to that. Number one is that I get it, the question, and, you know, this is why, if you really look at it, they've set these targets right now at 50%, which is simply just getting them the clinical summary, and then we're only saying, you know, they've set a, in my opinion, pretty low bar, although we're finding that it's a little bit harder than and I believe that's why this listener has asked that question. The 5% is getting tough to hit, but it's 5%. Now, the question is, will that go up? In all likelihood, it probably will, right, for stage 3, because, again, we're trying to produce better outcomes, and we know that the only way to do that is to get patients engaged in their own health to a degree to improve that. What the second thing I'll say on that is that there's the how piece of how you do that. And
I'm glad you're addressing that, because that's actually the next question, maybe all we have time for, is what's a practical way to sort of encourage patients to sign on and use these tools?
So it's a great question, and the how of all this is really who's going to have, you know, the best patient experience, right, and the best customer satisfaction, et cetera. What we believe is at EngagePatient is, number one, you've got to think about the mobile technology and where that is. And today, consumers, I'll use the word consumers versus patients, consumers today can do so much from their smartphone. They can do so much from a tablet. They can do so much, right, from a computer. And what they are able to do in their social lives, in their banking lives, in their retail lives of shopping, how do you bring that type of experience to healthcare? And to engage patient, that's what patient engagement is about. It's not about trying to make things more difficult. It's not about trying to hammer a regulation for the sake of checking the box. What we really want to do is truly help the provider space in communicating with their patients so that they really can focus on and do what I believe all physicians want. They want to take care of their patients. You know, that's why they're in this profession, and to make them better. So how we do that, Brian, is we obviously have a mobile platform that is integrated with the EHR, and we allow the patient to schedule or request that appointment, which is typically the first step of the patient experience. And then from that, now we have their email, we have their cell phone. Now we've just connected that patient through whatever device, web-enabled device they're using, to the practice. And now you layer in the communication platform on top of that. You can now push that clinical summary, for example, to the patient. And as soon as you do that through our patient engagement platform, and you know, there are others out there, we obviously think we do it better. I can text Brian and say, Brian, your clinical summary's been posted to your personal health record. Click on the link to view it. And okay, we just added one click to the 5%. So, and that's just one very small example, but that is how we see driving that experience and allowing patients to to be able to do the things that they do today in their everyday lives and the experiences that they are able to do in their everyday lives. We are trying to use those similar technology experiences and apply that in a healthcare setting.
I'm glad you said that because, you know, there's obviously some providers have some concerns about whether they're going to be able to get patients to do this, but there's a flip side to it, which is, you know, I recently went to my doctor, great doctor, love my provider, but I was a little disappointed that when I went in there, the tools I expect, like I expected them to be able to send me a secure email, and they're not there yet. And that frustrates me, and I think there's going to be an increasing expectation on the part of the consumer, not only that providers offer these tools, like, you know, I want to be able to get into a patient portal and get in there and see my visit and my lab results and that sort of thing. It's a little frustrating to me that I can't do that at this point, but not just do it, but that the tool meet my expectations as a consumer too, that it be a good tool.
Exactly.
That actually makes sense to use. If it's just something that satisfies some government requirement, that's not going to encourage me to continue to use that provider.
Yes, and I think that's a good last point to end on. I know we're running out of time. Is that the last thing I would say is we've gone through these questions that our listeners are going to, hopefully we've shared some good information for them to ask their vendors on, but make sure that you're not just checking the box. I think that's kind of the last thing to end on, Brian, that you said. We don't want you to just check the box and say, okay, I can make it through meaningful use, because in the end, that doesn't get us to a fabulous, you know, patient and provider relationship.
Well, we didn't get to all of our questions, but I want to remind everyone who attended today that we're going to send those questions on to Justin, and he'll answer them and follow up in writing. They're also going to send some resources out to everyone who registered today. So keep your eyes open for those that email to show up in your inbox, because based on the talk today, I'm sure there's going to be a lot of great resources in there. I want to thank you, Justin, for joining us. Great session. Obviously, huge interest from the audience, so thank you for joining us today.
Absolutely, it's been great. I always enjoy working with ForMed Approved. It's always a very informative experience for lots of folks out there. So thank you for letting me join you.
Well, it's our pleasure, and I'd like to encourage folks to learn more about EngagePatient by visiting www.engagepatient.com. Notice that's an I at the beginning, not an E, so type that URL in, and then also look for those resources to come into your email box. I'd like to thank our audience for joining us as well. Remember that all registered attendees of the event will receive an email with links to both the slides and the video recording of the session, and we'll send those questions on to Justin for those we didn't get to. If you're interested in learning more about meaningful use, you can register for ForMed Approved Certified Meaningful Use Professional course. The course covers the requirements for both Stage 1 and Stage 2 for both eligible professionals and eligible hospitals, along with clinical quality measures, HIPAA considerations, and more. Visit the URL on your screen there, formedapproved.com/curriculum.php, to learn more about that course. Visit formedapproved.com to learn more about our upcoming Learning Lunches. The Learning Lunch button will take you to our entire slate of upcoming webinars. The next one will air on February 24th, and will cover the subject of simple steps and tools for achieving compliance for HIPAA and MU. Keep an eye on your email box and our homepage for other upcoming topics, and thank you again for joining us today.